I think let's go to our final set of questions for today. And they're coming from Nibasumba Emile. And Nibasumba is a journalist at Radio Publique Africaine from Burundi. And she has two questions. The first one, Burundi will not get COVID-19 vaccines for the first phase, but it is among the low-income countries. Did it not ask for the vaccine? And what really happened with Burundi? So those are two parts to the first question. Then the second question, can you please explain the whole process for it to be decided that the vaccine against COVID-19 is sent to a country like Burundi? I think what she's saying there is, please explain how the decision is made for vaccines to be sent to countries like Burundi.
So very good question. I cannot address the specifics of what Burundi has done or not done. As you can imagine, that I'm not privileged to those negotiations at the country level. But the process for COVAX is simple. I mean, the countries are sovereign. They engage with Gavi. Again, COVAX is a mechanism that brings WHO, Gavi, and CEPI. CEPI is the Coalition for Epidemic Preparedness Innovation together. So they discuss directly with that facility, period. That is all they need to do. And then based on their level of where they are categorized as low income, middle income, or high income, they would have those discussions going forward there. So I think that's all I can tell you with that mechanism. With AVAC is the same. The African Union mechanism is that we've shipped out all the materials that are required to countries. The forms have been sent to them. It's up to Burundi to go into the system and ask for their vaccines. And if you go into the amsp.africa, you actually can see the allocations of, and countries have access to that. They can see the allocations of how many vaccines are allocated to countries using very objective criteria, population size, maybe the pandemic and other factors there. We did this same exercise during the diagnostics. When we were having the diagnostic challenges, we arranged for the diagnostics, allocated them their quotas to countries, and the countries were able to go in and acquire their diagnostics. It's the same process and mechanism for the vaccines allocation. So Burundi, in short, can go into the platform. They have Africa CDC platform and source for their vaccines. I don't know what they have done with COVAX. I'm not privileged to those in-country discussions.